and people are dying in Africa. How do you think Africans feel when you have this scourge that's going on?
Well, one, I think from the point of view of the African, they may not understand why the U.S. government is doing that. I think the U.S. government is doing that to protect themselves, one, for litigation purposes. Two, they're not fully sure of the consequences of this drug. It might be okay now, but you never know the side effects. The side effects could be worse than this.
Ebola.
Nobody knows. But again, if they found to be positive for this, that's everybody's looking at because it's needed. I mean, take for instance HIV. The drugs. I mean, the drugs can reduce the thing, but they cause all sorts of things. But again, not in an epidemic proportion. So, and I think there is a pressure on the U.S. now. I mean, they're having congressional hearing now on this matter because some people are taking them up. Why can't Africans have access to this? So they need to debate that. And I think it is a matter of ethics, it's a matter of law, it's a matter of, I mean, what, you never know the consequences of this drug, but again, there's a need for this. But I guess they will soon resolve it. But probably not, we do hear now that there's a test kit that we should get onto the market that might make it easier to detect people rather than we waiting for you take the blood and go to one or two laboratories that have the capability to do the testing, and it takes quite a while. And that's one of the delay in having proper diagnosis and instituting people to treatment.
Okay.
So I guess it will be resolved shortly.
Sorry, Alera, let me just ask, there is someone on Twitter that raised something and said that Ministry of Information in April said Nigeria had a vaccine and we should not panic. Is that true? Yes, that was supposed to be months ago when this issue
against Ebola.
Yes, it's.
I'm very much unaware of that.
You're unaware of that. Okay. Okay. Maybe.
Okay.
I'll let you
Doctor,
ask the question.
medical doctors are still on strike in Nigeria, and there's this imminent danger. What would you say to doctors like yourself that this thing, the Hippocratic oath and all that, this danger is looking us in the face, and yet doctors are on strike, the hospitals are empty?
Funny enough, I was with the president of NMA yesterday.
The one who resigned?
Has he resigned? I don't know.
Well, we heard, yes, that he resigned.
I read it in the paper.
He resigned
Yes.
last night.
Obimbe?
Yeah.
Yes.
Oh, the former president then. Okay. Basically, our appeal to the NMA that, worldwide, we should have good skills of crisis management and conflict resolution. Yeah, I'm a doctor, and first and foremost, my loyalty is to my profession. But at times, you weigh what you have on ground. You should not be rigid. There should be some degree of flexibility. So I would just implore all of them to please call off the strike and go back to work in the interest of national unity and peace.
Okay. Having said that, let's take a look at your constituency, so to say, but not in the medical profession, but talking about Abuja. What is it you're doing to sensitize the people in Abuja to let them know what they need to do? Because Lagos State, again, this is where we are, so we get to know what Lagos State is doing on channels, television, but we don't see enough of what Abuja is doing and other states are doing. What is it that is being done in Abuja to sensitize people, get them be aware and prepared? Because international flights are coming into Abuja now.
Yeah, true. Yeah, the advantage Lagos State is having is just location advantage, because Channels is in Ogun State or Lagos. So if people concentrate there, that is it. That is just it. In Abuja, like
Channels is also in Abuja.
But you can see this now.
Okay,
we have over 500,000 of this.
Okay.
You can see this again.
So these are...
Yeah. So, like I said, everything boils down to sensitization and personal hygiene. If we want to know the determinants of health worldwide, 35% is your socioeconomic status, another 35% is your lifestyle management, and 20% is your clinical care, and just 10% is hereditary. So meaning if you get 35 right plus 20, let's assume everybody is not in that high cadre of socioeconomic status. 35 plus 20, that's 55. And your genetic whatever, 10, 65. So you can see that already. So everything boils down to your lifestyle management and having a proper healthcare system in place, your public health infrastructure. What we've done in the Federal Capital Territory under the leadership of Senator Bala Mohammed, the Honorable Minister of the Federal Capital Territory, like I said, the first thing we did was to sensitize all the private healthcare facilities across board. That's why the 3 suspected cases in the Federal Capital Territory were from the private hospitals, because government hospital is on strike. 2, the area council in Abuja, we use area council instead of local government. You know, we also sensitized an advocacy to all the chairmen of the 6 area council, all the traditional rulers, the faith-based organization. Then we now train, there's what they call the disease surveillance and notification officer in each area councils, and also in the health secretariat. You know, we sensitize them to know what is expected of them. Then we used the National Orientation Agency, because in Abuja, over 70 or 80% are community rural dwellers. So, you know, we use the National Orientation Agency to have massive coverage. Then we've been on air. You know, there's what they call a popular bracket program in Abuja in one of these radio stations. We've been on Kakaki, we've been on Wazobia FM. Here we are in channels. This is another form of sensitization. You understand? So you can see that the Minister of the FCT is doing so much. And I said earlier, on Monday, 2 p.m. to be precise, after the commissioning of the Trauma Center by Mr. President, His Excellency, we're having an Ebola stakeholder meetings where everybody is coming. You know, we'll talk about what we've been doing and everything. And more importantly, we've gotten the PPE, the personal protective equipment. We have over 1,000 in place. So you can see that we are doing the needful. We are being strategic in our interventional skills.
And the Commissioner for Health in Lagos, Dr. Idris, just said that there is an issue of funding for this project. What is it like for the FCTA? Is the federal government funding and giving adequate?
For the Federal Capital Territory Administration, it's a responsive and a responsible government. Yeah, you know the ever-decreasing budgetary allocation, and if you are conversant with what is happening, with what all the states are saying that their revenue, whatever, is dipping. But it is a first line of priority in FCTA. Even the minister has directed that we can even deduct from the Sure P funds, because this is an emergency. So presently, as at today, and I don't think there will be a problem, we are not handicapped with funds.
Okay. We have some reactions from home.
Sorry, Dr. Idris.
The issue of funding is not a Lagos State issue. I must tell you, everything we have asked from the government of Lagos State has given us is not holding it back. That's why we're able to move faster than we've always moved. It's given us every single penny we asked for, and is willing to give more. And in addition, like to get, what we had is that getting personnel, people to come and assist, to treat the patient, to do contact tracing.
But do you think anybody will want to come and work on Ebola
Well, that's
projects?
why we're ready to provide whatever it is. We ask them whatever it is they want, we'll give, including life insurance, everything. We've announced that we're willing to do that.
So those who want to help, they'll get life insurance.
They have a life insurance there for them. What we want to do is get this thing quickly under control. So we'll do whatever it takes to get that done.
Okay. Well, reactions from home. Dayo Kende is addressing you, Dr. Onokumaya. Abuja residents don't know the location of the isolation centers. Where exactly are they?
Yeah, for now it's in Kuje General Hospital.
Just one?
Yeah.
Kuje General Hospital. Yeah. Okay.
Okay, so Oladipupo Usman says, what is Lagos State government plan to reduce infection vis-a-vis resumption of public and private schools?
Well, yeah, there's a plan in place now. When we wait for, I was supposed to deal with the Minister of Education. Right now they're on holidays, and we have to assess the process to go through. If we need to ask them to extend the holiday, we'll do that. We haven't gotten to start yet, but there's a working plan that's been addressed now by even the Emergency Operations Center to advise government on what to do. But more importantly, the education is very, very paramount. Let the mothers know what to do. Even they are at home now, what they should do at home. And if they come to school, I mean, it's not a scare. There are certain things they must put in place in terms of encouraging personal hygiene amongst the children, teach them how to wash their hands properly, educate them what and what they notice. If they notice their friends having fever or diarrhea, feeling funny or looking ill, they know who to respond to. And again, the plan is also to train the teachers to be able to watch out for some of these signs and symptoms.
Well, Solomon asks, is it possible that a particular individual could have stronger immunity and not be infected even after he's exposed to someone who has Ebola?
Yes, what we do know as it is now is that somebody who has passed through the phase of Ebola infection and is lucky to be a survivor, for example, can still carry the virus contagiousness probably for another 6 weeks, so to say. Well, we haven't gotten real information as to whether there can be live immunity to that. I mean, I wait for the experts to still talk on the issue of having live immunity. What that means is that you pass through the phase of it, now you get exposed again, are you likely to suffer it again or not? We're waiting for further information on that. That's number one. And another area that I would like to point to is the fact that, because I heard my brother mention about the enemy strike and the private sector. I mean, that private sector is my immediate constituency. Let me just put it that way. And the general practitioners, as it were, I mean, like it is today, we are the goalkeeper. We are the first point of call when these sufferers come around. And we have the first contact and the second level of, the first contact caregiver and the second contact. The front desk officer, the nurse, and whoever will take the vital signs and everything, they get involved at the first stage. Then, having raised suspicion, then it comes to the challenge of, who takes now the specimen? What do we do next? Which is now where this PPE and other things, where they come in. As it is, I'm so happy that my brother mentioned about 1,000 of such in FCT. Even in Lagos, where the deed has been done, we have not gotten that opportunity from federal government empowering us with that level of PPE. I know it's a costly material, but as I'm talking to you, we are getting alerts. Lagos is highly concentrated of, suspicious cases. And I receive calls virtually every 48 hours, for example. And recently we're giving, I'm forced to say this, 20 pieces of the PPEs for the entire over 3,000 facilities in Lagos State. And
should we be making that call to the federal government? Because it's not a Lagos thing alone. If it
we
spreads beyond Lagos.
We are making contact with the Federal Ministry of Health. I'm just telling you that we got those 20, not from Lagos State government. Lagos State government came proactive, sincerely speaking, because they quickly muster resources, pull the general practitioners to themselves, for example, the private sector. We all start. We even plan the cremation, of this other victim together to make sure, we got, on top of the situation. What I'm telling you right now, the distress calls we have, everything we have is about where do we get some PPEs for us? We're already exposed. What do we do next? And really, it's not a false alarm.
Okay. All right. We got to wrap up now, but Dr. Idris, that would be your last word.
Yeah,
Yes.
The issue of, I want to say Ebola, but it's not a death sentence. We need to allay that fear. Mortality rate is between 40 and 90%. People have survived it. Now, that's why it's very important for people to know. If you have Ebola or if you suspect you have Ebola, the people need to come out. Because that way, you don't infect other people. Two, you're quickly brought under treatment. But once it's properly treated, the chances are that they will survive.
But there's the impression that it's got no cure. Something that has no cure.
Yes,
then
it has no cure.
Yes.
But it can be treated.
Okay.
The treatment is supportive because you have to address all the signs and symptoms. If somebody comes with fever and vomiting and diarrhea, you need to replace the fluid and the electrolytes. If you can do that, if you can address all the various symptoms, the chances that the person will survive is when the person doesn't come for treatment that the thing goes down. Because 10 to 60% of people have survived. We need to understand that. So it's that fear that is driving people away.
Okay. Well, indeed, the NACA chairman did say that HIV/AIDS is killing more people than Ebola. So that is something that we should think about. Thank you all very much for coming and sharing your insights with us on this matter. So as you heard the commissioner say, having Ebola is not a death sentence. As soon as you feel the symptoms we have spoken about, make sure you run to a hospital and get tested. I'd like to say thank you to the Commissioner for Health of Lagos State, Dr. Jide Idris, as well as thanks to Dr. Demola Onokomaya, who's the Honorable Secretary, FCT Health and Human Services Secretariat in Abuja, and Dr. Adeyeye Arigbabuo, who's Chairman, Association of General and Private Medical Practitioners of Nigeria, Lagos branch. Thank you all very much for coming.
Welcome. Thank you.
Sunrise will return in just a moment with yet another interesting conversation. Make sure you're part of it.